U.S. adding another weapon in the fight to contain COVID-19. The FDA granting emergency use approval to Johnson & Johnson for the vaccine that requires only one dose instead of two. The first shipments of the newly approved vaccine could start as soon as Monday, but Johnson & Johnson says it expects to deliver 20 million doses across the U.S. by the end of March. This is now the third coronavirus vaccine to earn FDA approval since late last year. The Pfizer vaccine was the first to be approved on December 11th. Moderna's vaccine earned approval just 1 week later. And with the approval of this third vaccine, we're working to analyze the differences between each one. Joining us tonight on NewsNation to help break everything down is Dr. Stephen Thomas, Chief of the Infectious Disease Division at SUNY Upstate Medical University. So, Dr. Thomas, thank you for joining us.
Thanks for having me.
So there are reports that this vaccine can also help prevent asymptomatic infections.
Yes, and that's very exciting information. So it was a small number of cases, but the trend was certainly there. And this is important because we know that these vaccines are preventing people from getting sick, and in the case of the J&J vaccine, specifically moderate to severe disease. But one of the big looming questions is whether or not these vaccines will actually be able to lower a person's infectiousness, even if they do get infected. And so this is some preliminary information that's giving us some exciting news that it might be possible to do that.
It is really exciting news. So the Johnson & Johnson vaccine is 72% effective at preventing moderate symptoms and 85% effective at preventing severe symptoms. And no one who got the shot had to be hospitalized or died. But many are focused on those efficacy rates being lower than Pfizer and Moderna. Is that a legitimate concern?
I do not think that it is a concern. So moderate to severe disease and hospitalization and, of course, death, that is what is making up the big public health burden of COVID. And to be able to reduce somebody's risk of having one of those outcomes by, more than 70% in the case of moderate to severe disease, and there were no deaths in the vaccine group, this vaccine is going to have a huge public health benefit. And just for context, annual influenza vaccines, their efficacy is about 45%, and they have a huge positive public health impact every year. So again, this is a very exciting news.
And not the least of which, because it's been rolled out, doesn't need the extreme cold temperatures, and you only need one shot, right? That's going to make a huge impact on the distribution.
Absolutely. So, both the Pfizer and Moderna vaccines have some logistic challenges associated with them in terms of being two doses and having to schedule people to come back at the right time, and also the temperatures at which they need to be stored. And the J&J vaccine overcomes some of those. So, one vaccine providing very good efficacy and being able to be stored at temperatures that we're used to storing vaccines, so in a normal refrigerator for up to 3 months, that could certainly help with getting vaccines out to more remote places and getting more people vaccinated.
So this is great news, and we've gotten also good news in terms of the number of infections. It's been going down finally. Do you think that there will be, though, another surge of cases in the spring, as some health experts are predicting?
Yeah, so, it depends on two things, I think. The first is whether or not we're going to remain vigilant with our public health interventions, of which wearing masks and social and physical distancing are the foundation. That's the first thing. The second is, how is the vaccine rollout going to continue, right? We started a little slow, but we're doing much better now, vaccinating almost 2 million people a day. And once we get J&J into circulation, that number could certainly go up. But the other thing that's kind of looming in the background are these mutations that are creating new variants. And although, the J&J vaccine was 72% efficacious in the U.S. against moderate to severe disease, when you look at how it performed in South Africa and how it performed in Brazil, it still performed admirably, but it was lower. And so we need to get as many people vaccinated as quickly as possible and not give these mutations an opportunity to take hold.
So obviously we know the expert advice is to take any vaccine you can get, right? But are there some vaccines that are superior to others in terms of these new variants especially?
Yeah, so, only a few of the vaccines were tested at a time and in a location where the variants were the predominant virus that was circulating. So we have laboratory data for Pfizer and Moderna, which shows that there should be efficacy against those variants. And then we have field data from AstraZeneca and J&J and Novavax. So, you know, again, it's not a qualitative thing. So it's not either effective or not. There is still a moderate level of efficacy, and the manufacturers are already looking at pivoting and making new vaccines that are directed specifically against some of these variants. So I don't. It's time for concern. It's not time for panic, and it's time for us to get as many people vaccinated as possible.
All right, Dr. Thomas, thank you for joining us on a good news day concerning COVID. We appreciate having you here.
Absolutely. Thank you.